Hi again, Karen here. This is day 2 after I have had the permanent spinal cord stimulator placed in my back. Well, I gotta say, I'm actually in more pain today. I guess all the anesthesia and all the medication they gave me during the surgery and after the surgery has kind of gone away. And so now I'm just dealing with like raw pain. And you know, if you've had surgery, you know those first few days are pretty bad. So the thing that hurts the most is where they placed the little like they call it the little pacemaker, or the little the mechanism that controls all of the stimulation. I call it the pacemaker. It's the best way to say it. The little metal object that they put inside you that they hook up to the stimulator, which is then on your spinal cord. Again, I had the paddle put on. My company was Boston Scientific, and so yeah, last night I did fall asleep, but it was like here and there. I did take a sleeping pill, and I'm on pain medication, so I did kind of doze off for maybe an hour at a time to a half hour at a time. But I did get more sleep than I thought I would. I didn't think I would sleep at all, but I did. Most of my sleeping, I was sitting in this same chair. I take my nice big pillow, put it under my head so my neck doesn't droop, and I just fall asleep right here at my desk. And then I would walk into the bedroom from time to time, maybe sleep for half an hour in the bed, then come back. For some reason, lying down is very uncomfortable, because you could really only lie on the one side, because the side that has the implant, it's really very, very tender. Very, very tender. So you can't, I mean, it's hard even to, excuse me, it's hard even to touch it. Even if I were to, a little wind would blow near it, it's just very, very sensitive. I think a lot of the pain also stems from the table that you're put on during the surgery. If you've ever had back surgery, the table, now this is my experience with the table. I guess if you have it done in different places, it might be different. There's a place for your head, and then there's just like a place, I think, I want to say it's for where your ribs are, and then there's like nothing in between until it gets down to your legs. So you're kind of hanging on this table, so the doctor gets the best access to your back. So it's great for him, but it's not so great for you. And I know that this pain, I've had this pain from the last 2 back surgeries that I had, and it is very painful. Where they put the stimulator right now, I gotta say, it's just a little bit itchy. That I'm not really feeling that much, but where they did put the little pacemaker mechanism, that is very swollen, black and blue, and very tender, very, very tender to the touch. To like, even if I just go and put the blanket on it, it's very sensitive. I've also been noticing, I've been using my walker. I've been upstairs in my house the entire time. I haven't ventured to go down the steps yet. At this point, I'm just kind of too tired. I feel a little too weak and too much in pain to try and make the steps. And thank God my husband's here taking care of me, bringing everything up that I need. But a couple of things you want to make sure you have when you have this surgery. This is a gripper. It's a gripper. And it's got this for any time you drop something. And of course, the minute you can't pick something up is the minute you drop something. So as I'm dropping things, I'm using this to pick them up. Very, very helpful. Because of course, I mean, some people could drop things and they don't really care. I don't want my husband having to run around picking up everything I drop. So I can't stand it when I drop something, so I'm constantly using that to pick things up. That's also good. If you do have a walker in the house, it's very helpful. I happen to have one. I actually have a rolling one, but the one I'm using is the stationary one. And it's I guess I could go without it, but just to have that peace of mind of preventing me from falling. So that I am definitely using. My pillow at my desk. I mean, some people find it a lot easier to sleep. I have a lot of trouble falling asleep as it is. So to fall asleep in all this pain, in a mess, it's kind of difficult. So I take my pillow, sleep at my desk. I'm having a lot of pain in my forearms, which is really odd, and I'm thinking that when I went through the surgery that my arms must have been up over my head, and I must have been in such an odd position for so long that when I actually go to pick up the walker, which is like a pound, it's like I could feel the top of my arms really hurt for some odd reason. My lips again are very cut up. Sure, from having the tube down my throat, they probably then taped it because I had all glue on my face. Glue, you know, where the IV was in my hand. Also very sensitive. Again, though, the Boston Scientific representative gave me 2 programs right away. He said, I'm not going to program anything for your back at this point. He just basically gave me programs for my legs, which is a big part of where I have most of my pain. And I've had on continuously the one that I don't feel. They have programs of stimulation where you feel them and where you don't feel them. While I was going through all of this pain from the surgery, I opted to use the stimulation where I don't feel it. And I have to tell you, thank God my legs aren't that bad, so I can get up and walk around without too much problem. So in my mind, that makes me believe that the stimulator's working properly and will be a big success in the future. Just right now, it's trying to get through like this week or 2 of agony, and I'm telling you, I'm not gonna say, oh, it's easy. It's not easy. It's surgery and it's painful. And that is about it. That's not really much else I can tell you right now. Just where they put the pacemaker, it's sensitive, it's tender, it's black and blue, and swollen, and it hurts. And that's about it. They also gave me a prescription for Flexeril, which I've been taking. It's a muscle relaxer. And I'll come back. This was day 2 after the stimulator was put in, and I'll be back tomorrow to update you again.